All right, hi guys. So I'm gonna go through, I'll do 5 different videos for the 5 different orthotic devices that you guys will be skill checked on. They include an AFO, a shoulder sling or immobilizer, a hinged knee brace, a knee immobilizer, and an LSO. So I'll have a separate video for all 5 of them so you guys can get an idea and see what you need to include and kind of how we go about donning and doffing them. So when we are gonna put on an AFO, you guys, they're, again, usually custom made because this needs to be molded to somebody. We have a bunch of different shapes and sizes in the closet at school. So chances are you can find at least one that will fit you or fit within your shoe. When you guys do your lab checkoffs, I'll have like 6 different versions in there, so don't worry if you think you're gonna get one that won't fit on your patient or your partner. There'll be like a bunch of different ones in there, so you can be sure that it at least kind of fits, okay? We know these aren't made for you. So when we are gonna utilize an AFO for our patient, we first need to determine which way is which. Is this a left or a right? You can always feel a raised portion, okay? So that's gonna be this medial side here. This is gonna be the inside where your arch is. So you're always gonna have somewhat of a bigger raised area for where the arch is. So this is a right AFO. For this, you guys, there's 2 ways that you can put on an AFO. It depends on the patient, it depends on the type of shoe that they're wearing, it depends on the AFO itself, which one is easier. I find it's like 50-50 which one works, and it's whatever works better for the patient, okay? So first one is you can put the AFO on first. I always want to have 1 layer, okay, of something, whether it's a sock, stockinette, whatever it is. We're looking to reduce skin irritation and we're looking to absorb moisture inside the sock because skin maceration, when it's kind of white, it's easier to break down when it is moist, okay? So for this guy, I'm gonna always align my heel. Make sure the patient's heel is all the way back in the AFO. This one doesn't fit me correctly. Usually this will go all the way up and support the entirety of my foot, okay? A lot of the trial ones are a little bit shorter, that way they can fit in anybody's shoe, okay? So for this is a nice padded addition here, you guys. Some of them, and this comes on and off, it's Velcroed, so you can take it on and off and adjust it if need be, but make sure that it goes all the way around your patient's calf so they don't get irritation. So patient's foot goes all the way in, heel all the way in. I'm going to wrap this around, you guys. It is so important to make sure that the sock has no wrinkles in it and that this cushiony part has no wrinkles in it. Wrinkles, when we are compressing and tightening things up, can lead to tissue ischemia, can lead to blockages, can lead to cutting off of circulation. Wrinkles can lead to skin breakdown if they're there for a prolonged period of time. That's compression on the skin that doesn't need to be there. If you ever, I wear a rubber band around my wrist a lot of the time, and when you have something, that is around it for a long period of time, when you take it off, it's red, it's indented. This is gonna be something that they're wearing all the time. So we wanna make sure that they're not having that skin breakdown or that risk of skin breakdown. So everything needs to be nice and smooth, no unnecessary wrinkles. So this just goes around here, okay, wraps, make sure everything is aligned properly, nice and secure, nice and tight. Okay, so my heel is all the way back in this guy. When you're gonna go to put on your patient's shoe, then do yourself a favor, Kathy, get up. Do yourself a favor and loosen up these laces, you guys, like all the way. Okay, give yourself some room. These things can be turned into an alligator wrestling match sometimes when you're trying to get it in a shoe, okay? So when you're trying to get it in a shoe, Kenzie, go away. When you're trying to get it in the patient's shoe, okay, you can have them, whether they can hold their leg up or not, okay, you're holding their leg up, and usually I'll just shimmy it and slide it. You're gonna pinch your finger if you try to keep your finger in here while you're sliding it in, so be super careful not to pinch your own finger. So when I'm trying to slide this in, usually I can shimmy, shake, and push, bam, and usually I'll slide it up and down a couple of times because this kind of back portion of your shoe can get kind of caught up underneath and folded, okay? Always need to tie our patient's shoe when we are done and when this AFO is in, and I just pulled my shoelace out, okay? So tie your patient's shoe, please, please. Your patient cannot stand up on this AFO without a shoe on. It is slippery, it is slick, it is not safe. So there always has to be a shoe encompassing the AFO. Okay, that is how we put on our patient's AFO. One way, first way. Okay, when you're taking it off, loosen it up again. It comes out a heck of a lot easier than it went in. Okay, so make sure that loosen everything up, shoe comes right off. Okay, second way, okay, that we can put this on is AFO in the shoe first. Okay, So I have my patient's shoe. I still loosened it up quite a bit, okay? So when I have this, I'm gonna slip the AFO in here first, okay? So when I have this, then I'm gonna have my patient then slide their foot in, and it almost creates like a little slide here for your patient's heel. Sometimes this is a little bit easier, and your patient can even put it down onto the ground. No, that's not good. Can even put it down onto the ground. Terrible, get out of the way. And they can push into it a lot easier, and it just kind of slides in. So that's another method that you can use, okay? So that way, once the AFO is in, then I would come up here, make sure I have no wrinkles, no creases. Okay, Velcro around, make sure it's tight and secure. Okay, tie my patient's shoe. Again, make sure it is tied and tight. Okay, things that I want to watch for here, okay? When my patient is wearing these, I may have them, you know, we start off kind of with a wear schedule. They're not gonna go from never having it to trying to wear it 24 hours a day. It is something that our patients are probably gonna be wearing for most of their day while they're up and moving around. So I need to make sure that these edges here, which we have some good padding, but these edges here are at a higher risk. This is a hard plastic of kind of digging in. So if your patient has kind of meatier calves, or if they're even a little bit more atrophied and they have a little bit more soft tissue kind of floating around, you're at a higher risk of skin breakdown there. So we need to make sure that they're having no what we call like hot spots, where you see any red, rubbing, irritation, or if they feel like it's digging into them and causing pain anywhere. Those would be my red flags, that we would either need to add a little bit more padding. Maybe we need to consult with the orthotist and see if we can get it molded or fixed a little bit. Usually it's just as quick as melting it down a little bit, and rounding some edges out. Okay, there's our AFO.